That work that we did on race and ethnicity data really highlighted the fact that many state Medicaid programs don't have high quality data on enrollees' race and ethnicity. And so that would mean they wouldn't be able to accurately monitor whether work requirements or other policy changes are causing some groups to lose coverage more than others. This could be especially true of some of the smaller racial and ethnic groups who often get aggregated together. We've done some work on Asian American Pacific Islander and Native Hawaiian folks who are often grouped together. And we have seen, for example, during COVID, that when those groups are lumped together, it can really hide the experiences of some of those smaller subgroups that might be facing more challenges with something like disease burden, but also with some of the processes for navigating something like a work requirement that really requires, understanding a policy, being able to communicate with the state about exemptions or compliance, and then for the state to really monitor how policy changes are affecting different groups. Yeah, I'm really glad you're thinking about that group. It's such an important period of life to think about because we know that most pregnancy-related mortality occurs during that postpartum period. I think some people are surprised to learn that. And we know that most pregnancy-related mortality is in fact preventable. So really important that people have coverage and access to care during that time. So it's a little hard to say how work requirements would play out for that group because the proposals have several states, I think it's about 13, had submitted waivers for work requirements under the first Trump administration, and then we've seen a few different federal proposals. And so those have really varied in terms of whether pregnant and postpartum women are exempted from the work requirements and in terms of how parents are treated. Sometimes in some of those proposals, they have been exempted. In some, it's all parents of minor children. Sometimes it's just parents of younger children. Sometimes it's just a primary caregiver. So there's really been a lot of variation in terms of how that group would be treated under work requirements. The other thing to keep in mind is that now in 48 states, women who had Medicaid coverage for delivery are now entitled to 12 months of continuous Medicaid under this, what's called a postpartum Medicaid extension. That's now the case in almost every state. So they might be okay, even if a work requirement is implemented for adults in the expansion group, because they're entitled to that 12 months. So they could be maybe switched to the pregnancy related pathway. And if that pathway was excluded from work requirements, it's possible they wouldn't be explicitly at risk of losing coverage under a federal work requirement. But again, as I mentioned, we think a lot of the success of keeping people who are eligible enrolled during work under a work requirement depends on that data matching that the state might be able to do. So if that doesn't happen automatically, that might mean that new moms would face administrative hurdles, showing that they should be exempt. Certainly not a time of life when you'd want to have a lot of extra red tape to keep health insurance coverage. And we've done some of the work that we've done on the postpartum extensions suggests that a lot of pregnant and postpartum women aren't aware that the extensions are in place. So if they don't know that they are supposed to maintain coverage, and it could be very confusing hearing about work requirements and not knowing who it applies to, that might just add to those information barriers and keep people from accessing the care they need. And then just to go back to the point I brought up earlier about families, if work requirements, let's say even if postpartum women were excluded from work requirements, but their partners, for instance, might be at risk of coverage loss. We know that if any member of a family loses coverage, that really puts everyone in the family at risk of more financial instability and the person not getting the care they need.